Welcome to this training on multi-drug resistant organisms, or MDROs. Today we'll review what an MDRO is, the difference between colonization and infection, important documentation considerations, and key PDPM implications.
So what is an MDRO? MDRO stands for multi-drug resistant organism. An MDRO is an infectious organism that is resistant to one or more classes of antimicrobial medications. Because of this resistance, infections caused by these organisms can be more difficult to treat and may limit available treatment options. Some common examples include MRSA, VRE, ESBL-producing organisms, and CRE. It's also important to know that an organism does not need to have the word resistant in its name to qualify as an MDRO. What matters is whether the organism demonstrates resistance to one or more classes of antimicrobial agents. A key concept when evaluating MDROs is understanding the difference between colonization and infection. Colonization means an organism is present, but there is no active infection and no signs or symptoms of infection. Infection means the organism is present, and clinical signs and symptoms of infection are also present. When an infection is present, treatment may be required. This distinction is important because drug resistance alone does not automatically mean an MDRO diagnosis should be identified. When reviewing documentation, ask yourself two important questions. First, is there evidence of drug resistance? Examples may include resistant culture results, failed antibiotic treatment, a history of resistant infections, or culture and sensitivity reports showing antimicrobial resistance. Second, is there evidence of an active infection? Examples may include signs and symptoms of infection, ongoing treatment, or provider documentation supporting the diagnosis. Remember, drug resistance alone is not enough. Evidence of an active infection must also be present, and provider confirmation of MDRO status is required. As a final takeaway, remember that MDRO means more than a positive culture result. To appropriately identify an MDRO, there must be evidence of drug resistance, evidence of an active infection, and provider confirmation of MDRO status. When reviewing documentation, look for clinical support, review culture and sensitivity results, and verify provider documentation. It's also important to remember that appropriately identifying and documenting MDRO status may contribute 1 NTA point under PDPM when the required criteria are met. If documentation is unclear, additional provider clarification may be appropriate. Thank you for participating in this training. This concludes our presentation.